Welcome to our Thursday educational webinar on the basics of Medicare in detail. So every other week, we focus on a more comprehensive look at Medicare from A to Z. So everything you need to know explained in the simplest terms possible. So let's go ahead and get started. My name is John. I'm president of Riley and Associates. We are a local independent insurance agency. We specialize exclusively in Medicare and have over 20 years experience in health insurance. Today, we're going to cover the basics of Medicare. We're going to go on the basics of Medicare, your two options, and then our services. So before we jump in, let me provide just a little context. We have a 3-point system we take each time we work with a client. The first one's the discovery call, where we just gather your information, understand, what type of plan you're using, medications, that sort of thing. The second one is a pre-enrollment presentation, and we're going to kind of go through that today. But the pre-enrollment presentation, that's where we go through the basics of Medicare, and then we go through the options based on the needs that we discovered from the discovery call. And then we enroll you in that one. And then in the third meeting, which is usually a few weeks after your enrollment, you've received your welcome kit, we go through a second presentation called the orientation meeting. And in that presentation, we just go through your plan, make sure we get all your questions answered, and you know how to access your benefits. We also have an excellent PDF that we prepare specifically for you with all your links and information on your plan, just to make everything comprehensive and simple in one document. Okay, but I just kind of wanted to give you an idea. So today we're going to kind of go through that presentation, which is going to be the basics of Medicare. We're going to go through your options. Now, the options are going to be very general because we have to be generic today, but it will give you a good idea of what your options are, your two options, and kind of what those costs are. Kind of puts you in that ballpark. Okay, so our goal today is to keep it real simple. That said, Medicare has a lot of details, rules, deadlines. So we'll cover quite a bit today, but I'm in hopes that we can answer as many of your questions as possible. Okay. All right. So what is Medicare? Medicare is health insurance provided by the federal government for those age 65 and older, and those under 65 with certain disabilities. Most people are eligible for Part A and Part B as long as they're 65, they or a spouse is paid into the Social Security system for 10 years or 40 quarters. Now, Medicare has 4 parts, but we're going to begin with Part A and Part B, also known as Original Medicare, because everyone has to sign up for Part A and Part B. So you're either going to enroll 2 to 3 months prior to your birthday month of 65th birthday, or when you decide to retire and come off your large group plan. So let's take a look here. Part A here, Part A is your hospital insurance. This covers things like inpatient hospitalization and skilled nursing. Your Part B covers most everything else. It's going to cover your doctor visits, your labs, your x-rays, diagnostics, even outpatient surgery. So together, both of these are known as Original Medicare. Okay, and so now Part A is usually free for most people, and Part B comes with a premium, and you're going to pay that for life. And most people will pay a premium of $202.90 in the first year in 2026, and it will go up a little bit each year. Those that earn a higher income might pay a higher amount. And we're going to look at a chart in just a little bit that will give you a good idea of what you might be paying if it's more than the 202.90. Okay. So now that you know what Original Medicare Part A and Part B cover, let's take a look at all 4 parts. So Part A and Part B is your core health insurance known as Original Medicare, these two here. and they're going to cover your facility and all your other, doctor visits and outpatient services. Part C, also known as an Advantage plan, is an alternative way to get your Part A and Part B and a prescription drug plan. So it operates more like an HMO. And then Part D is your prescription drug coverage. Okay. So you only have two options. Either you're going to stay with original Medicare Part A and Part B, you're going to add a prescription drug plan because that's not included, and a supplemental plan, which will cover the out-of-pocket expenses, which we'll talk about here in a few minutes. Or you're going to go with option two. Option two is a Part C Advantage plan. It operates just like an HMO plan. So those are your two options, either original Medicare with a Part D and supplement, or an Advantage plan, which works more like an HMO. The good news is that in Medicare, both options are excellent options, and the coverage is excellent. So that's something to you can look forward to. Okay. Before we go any further, I would strongly suggest you set up what's called a discovery call 3 months prior to the month that you turn 65, or when you plan to retire and come off your large group plan and sign up for Part B. And why is this important? Well, you don't want to miss a step or a deadline. And during this discovery call, we determine your timelines, we compare coverage, we create a schedule based on your needs, and we begin preparing your presentation and options. So it's super helpful. Basically, what we're doing is we set your path, we guide you through the process, and get you enrolled on time in a plan that's right for your needs. Okay. Um, Also, for any employers or partners watching this today, we also suggest setting up a meeting for your employees at age 62, a pre-Medicare planning meeting, because their Part B or your Part B premium is based on your income. And so your income and other events could affect what your Part B is when you come off your group plan. And so if you pre-plan a few years ahead, you can actually strategize and know what your premium is going to be. You can plan for it, make adjustments. So if you're interested in that, we've got a checklist, a planning checklist, and a video. Just click the link below and we'll send that out to you. Okay. All right. So let's go ahead. We'll move on to our initial enrollment period for Medicare and then other specific election windows. So this is really important stuff. This is where we see people make mistakes is many times here. They'll miss their enrollment period, their initial enrollment period, things like that. So it's really important to understand that. So there's three main enrollment periods that you need to understand at this point, and then a couple which I'll just tell you about. Okay. So the first one's called your initial enrollment period here. This is when you're going to sign up for the first time for Part A and Part B of original Medicare. And then it's going to be followed by a pre-enrollment presentation with us where we choose kind of your additional coverage and covering those out-of-pocket expenses. That's going to be your option one and option two, which we'll discuss here shortly. And both will typically begin on the same day, which is usually the first day of the your effective day is the first day of your birthday month. Sorry about that. So when you sign up for original Medicare Part A and Part B, they actually give you a 7-month window. It's 3 months prior to your birthday month, the month of your birthday, and 3 months after. But as I mentioned, ideally, you should sign up 2 to 3 months prior to your birthday, and so your Medicare can go effective on the first day of your birthday month. Note, if your birthday actually is on the first of the month, so say it was on say this is April, and it was on April 1st, your effective date would actually be on March 1st. So if you sign up 2 to 3 months prior to your birthday month, which is what we recommend, and your birthday is on the first of the month, then it's actually going to start a month earlier than your birthday month. So of course, if you're working with us, we plan for that and we'll let you know. Additionally, if you're receiving Social Security income, uh, Social Security will go ahead and sign you up for original Medicare if you're receiving income prior to 65, 3 months before your birthday. They will automatically sign you up, and you'll get your card a few weeks before your birthday month. But for everyone else, you need to sign up online. And of course, if you're working with us, we have an email that walks you through it step by step. We're here for you as well, and that's part of your plan once we have that discovery call. Um, so anyway, the next enrollment period to know about is what's called your supplemental or Medigap enrollment period, which is right here. And that's going to begin when your Part B goes effective. So it would, for those turning 65, it's going to be on the first day of your birthday month that would go effective. And you've got a 6-month window to enroll in a supplemental plan to fill in the gaps for original Medicare without health underwriting, meaning they cannot deny you for any health conditions. So anyway, it's important to know that there's many ways to get enrolled in a supplemental, but when you first come on, you've got that 6-month window to enroll. So a supplemental plan is also known as a Medigap plan. And again, that fills all the gaps for original Medicare. That's going to be your one option there. The next enrollment period that you want to understand is here. This is called your initial enrollment period. And that's for everyone. This runs October 15th through December 7th of each year. And that's just basically a time where we'll do a checkup with you to make sure that, if you've got doctor changes, medication changes, that your current plan still is sufficient and covers those things. Otherwise, we run quotes, we can make changes for the following year. The last thing you want to do is go into January and realize that a medication is not covered or a doctor's not covered. So that's why you have that initial or the annual election period to review that each year. And we help you with all of that again. We actually start a campaign in August to get and you update securely your doctors and medications if there's any changes. And it just makes it really simple for us to review and then schedule a call with you if necessary. So the other two enrollment periods here, which I'll just explain, is the open enrollment period. And that's for somebody that already on Medicare, has a Medicare Advantage plan, the HMO version of Medicare. And that's just a time where in the first 3 months of the year, you can actually change between plans. So if you missed making a change during the annual enrollment period and you were on an Advantage plan, you could still make a change here in the first 3 months of the year. And we would go ahead and requote that and then get you on a plan that makes sense for you. Or the other option is you can also disenroll and go back to original Medicare at that point, which we can also help you with. The last one here is called the general enrollment period. And that's not one that you want to participate in. That's for everybody that actually missed their initial enrollment period, right? So generally, they're going to be paying a lifetime penalty for missing their enrollment penalty, for missing their initial enrollment period, and they're going to have a coverage gap most likely. So you definitely you don't want to be part of the general enrollment period. That's why it's really good. Like I said, set up a discovery call 3 months prior to your birthday or when you're going to move off your group plan and retire, and we can plan for all of those things. That way you don't miss a darn thing, right? Okay, so let's look at Part A and Part B, also known as original Medicare. So there's some out-of-pocket costs here, deductibles, co-insurance. Let's take a look at those things here in detail. So with Part A, your hospital, you've got a couple of different areas to be aware of. One is a deductible of $1,736 for 2026. That goes up a little bit each year generally. And then you also have copay that you would pay if you're in the hospital for 61 days or more, or skilled nursing. So that's important to know. Those are some of the out-of-pocket costs that original Medicare does not cover, which we'll show you how to cover in a couple options here. The other is Part B. Part B is your medical services. There's a $283 deductible at the beginning of the year for Part B. And once you pay through that on a supplemental, then you're done. An Advantage plan, it covers that. So this would be your only cost if you go with a supplemental and original Medicare, and then the 20% is also covered under an Advantage plan or a supplemental. Those are your two options, which we're going to jump into detail in here shortly. Okay. All right. So let's take a look. I had mentioned here at the beginning of the presentation for Part A, there was not a a premium for most people, but for Part B, there is, and it starts off at $200 and $290. That's the base. However, if you're making more than this amount here in these different brackets, you're going to actually be upcharged by Social Security. So instead of paying $202.90 on a monthly basis, you'd be paying $284, $405, etc., based on your income and how you file. Okay, so that's important to know. That's one thing. Second thing, which is really important to know, is when you first sign up for original Medicare, they're going to bill you for the first 3 months. So if for most people it's going to be $202.90 times 3, you're going to get a bill for $609. Then you can sign up for what's called Easy Pay after you make that first payment to Social Security. You can sign up for Easy Pay, so they bill you monthly. But just something you want to know is that that first bill is going to be big, so you want to prepare for that. And then the second thing you want to know is that if you have been upcharged, if you're making more than that, there's a couple of things you want to know. Actually, first one is that usually you're going to get that first bill for $609 first, then you're going to get a second bill with the difference in charges. Okay, we've got an email that explains all that and kind of shows you what that first statement looks like. So we usually send that out to you after the first presentation, so you can take a look at that. But that's something to know. And then the other thing is that when they determine what the IRMA, which is called Income Related Monthly Adjustment Amount, this is known as an IRMA chart. When they determine what your income is and what they're going to charge you in premium, they look at your tax return from 2 years prior, because generally most people have filed their tax returns 2 years prior. So they'll look at that. So if your last tax return is actually lower and drops you into a lower bracket, then you can file an appeal. We can help you with that too. We've got an email and forms for that. But you can file an appeal, and they'll go ahead, Social Security will review that, and we've had a lot of clients where they've gone ahead and reduced that premium for them. But they'll go ahead and review that for you and possibly reduce that. So some things you want to know, right? Okay. All right. So now I'm going to take, we'll take a look at your options. Sorry about that. But we'll take a look at this point. We've gone over your Medicare Part A and Part B, your basics of Medicare. We've taken a look at, the signing up, what your deadlines are and the time frames, and then what your costs are associated with original Medicare. So now we're going to go into your two options that will cover those out-of-pocket costs and those gaps. Okay, so there's two options. Now we're going to kind of step into those and look at those in detail. Before we kind of jump into those two options, I kind of want to go over what your current coverage is, just so you have a good idea. Original Medicare works a lot like what you have now, either a PPO or an HMO. So either with your individual health plan or your employer plan, you either have an HMO or a PPO. And so a PPO usually has higher premiums, higher out-of-pocket costs, but a lot less rules. It gives you freedom to go to a large network of doctors and hospitals. Usually you're not restricted to the local community or even the state. So it gives you a lot more freedom. An HMO, on the other hand, generally has a lower premium and lower out-of-pocket costs, but usually it has more rules. You've got a primary care physician who directs your care, and then sometimes you have to get pre-authorizations and things like that. And you're within a local network of doctors and a hospital. But that said, they're both excellent options when you move into Medicare. And with an HMO too, just so you know, you've got one of the best networks in the country here in Southern California. So when we look at your options here as we go on, you're going to see that both options, whether you go with original Medicare, a supplement on Part D, or you go with an Advantage, which works like an HMO, they're both going to be excellent options with excellent coverage. Okay, so option one, to cover the out-of-pocket costs for original Medicare Part A and Part B. They're going to pick up the deductibles, the co-insurance, the out-of-pocket maximum, that sort of thing. You're going to add what's called a supplemental plan. That's going to pick up those medical out-of-pocket costs, and then a Part D prescription drug plan. Okay, that's going to make you whole. That's going to give you a lot of freedom to go to any doctor, any hospital in the nation that takes Medicare with no networks, no rules. It works out really well. And you've only got one cost here, which is going to be your Part B deductible of $283. Okay. Your second option, which we'll look at more here in a minute, is your HMO option, which covers Part A, Part B, and Part D, and generally has lower premiums, if any, and lower out-of-pocket costs. So these are your two options, which this is original Medicare, which is like a PPO, and a Medicare Advantage Part C, which is like an HMO. So let's go ahead and take a look and see how original Medicare with a supplemental works, okay? So when you go to a provider, whether it's a hospital or a doctor, you're going to give them your original Medicare card plus your supplemental Medigap card. Okay. And they're not going to bill you anything. They're going to bill Medicare for the services they provide. And then Medicare is going to pay their portion and then bill the balance to the Medigap supplement company. Okay. So if you're on this option one where you do have a supplement, you're going to pay that first $283 at the beginning of the year under whether you go to doctors or labs or whatever it is. But then once you're done, they're going to pay for 100%. You're not going to pay anything else. So it's really quite a good deal. And these are all the things that Medicare does not cover, which your supplement does, that makes you whole. So your out-of-pocket costs are covered, your deductibles, your co-insurance, all of those things. Okay, and then you also have a little travel insurance, which is good, and we've got a little bit better one if you travel a lot. So let's move on. So option two is your Part C Advantage plan, which works like an HMO. So with an Advantage plan, you're going to choose, we give you options for different HMOs under Medicare Advantage, and it's going to cover Part A of Medicare, it's going to cover Part B of Medicare, and Part D of Medicare. And it's going to be with an insurance company, just like what you're used to in the past. Generally, you're going to have no deductible, and no premium for most people here in California. Depending on the plan, some do have a premium, but most do not. And they're also going to provide extra benefits like dental and vision. So you wouldn't have to buy those here if you went with an HMO Advantage plan. And a gym membership and some other things. So let's take a look at those. So it's going to cover Part A, Part B. It's going to include drugs, and it's going to cover these extra benefits like dental, vision, hearing, gym membership. Okay. All right. Let's move on. So here we've looked at your two options. Original Medicare is option one. This gives you total freedom. You keep your Part A and Part B. You pick up a supplemental plan that fills in all the gaps and pays the deductibles, and a Part D prescription drug plan. This gives you the freedom to go to any doctor, any hospital in the nation without a network and without rules and referrals and authorizations. So it's just a great way to go. But you're going to pay a premium for that, which we'll get into here at the end. And then here, option two, which is also an excellent option. It's an Advantage plan. It works just like an HMO. It's going to cover Part A and Part B of original Medicare. It's going to include your drug plan. Generally, you have no premium here, and it's going to cover all the out-of-pocket costs that Medicare does not cover, in Part A and Part B. So both options are excellent options. They're going to be far better than what you have now, either on your employer or your individual plan. Okay, so that's great news, right? Okay. And this is your Part D prescription drug coverage, which right now is built into your plan. Whether you have a PPO or an HMO, it includes a drug plan, but it works just pretty much the same. I mean, you've got different tiers depending on whether it's preferred generic brand, non-formulary brand, and you're going to pay a copay over here on preferred and regular generics. With a lot of plans, you don't pay anything. It's zero. And then you pay a percentage here or a copay. And so it works just like what you're used to in the past. The only difference here is that you've got a separate out-of-pocket maximum. So if you did have a really expensive brand medication, they would stop you out at $2,100. You would pay through a deductible first for your brand and non-formulary brand. For most plans, some of them you don't have a deductible if it's part of an Advantage plan. But either way, you've got a $2,100 maximum out of pocket. Now, if you were on this plan, on a drug plan here in mid-year, whether it's on the Advantage or whether you purchase it separate with your supplemental, and you got a medication that was really expensive, if it wasn't covered under that formulary plan, then we would work with you to find a provider to get it at a discount until we could go ahead at the annual enrollment period at the end of the year, review plans and get a plan that covers that and get you enrolled in that for the following year. So just so you know. Okay, all right. So this is just a different way to look at the same thing. You're blue, so the deductible, if you're for tiers 3, 4, and 5, this is a brand, non-formulary, and specialty. You would pay through that first, the deductible on the plan, if there is a deductible, depending on how you get your drug plan, and then you'd pay a copay here up to your maximum out-of-pocket of $2,100. Keep in mind, if you're not taking any medications, you're not going to pay anything. And a lot of the plans, when you get a supplemental plan where you have to buy the separate drug plan, a lot of them are $0 or $5 premium here in California if you're not taking much in the way of medications, or even if you are, sometimes that makes sense. So it really depends on what medications you're taking. So our best health plan is our own taking care of ourselves, right? So. So when I mentioned the IRMA chart there for Part B, when you pay a premium, if you're making a higher amount of money, then you're going to pay a higher premium to Social Security. I had mentioned there's the same chart here for Part D. So if you triggered Part B, and you're paying a higher premium for Part B, you're also going to trigger here. And so you're going to pay a little bit more to Social Security every month, and they're going to add that to your deduction each month. Okay, all right. So now that we've covered the basics of Medicare and what your options are, we'll take a look at our services and then kind of what those costs would be for option one and option two here at the end. So you have kind of a good idea of what you can expect, okay? All right, so our services, why do you need an insurance agent or team that specializes in Medicare? Well, it's complicated. There's a lot of rules. deadlines, and it can be overwhelming. So with us, we do the discovery call. We plan everything out for you. We have an email, video, and documents for everything that you need to know. We have everything scheduled out for you. We put together a schedule for you, and we review your plan and options every year. We take a look at your drugs and update that, your providers. So we're here to assist you, throughout the year. And then if we have to make any changes at the end of the year for you for the following year, we do that. And we also handle, dental, vision, things like that, where we can fill in some of those gaps for you. And just so you know how we work with you, like I mentioned at the beginning, we have a very simple process. We have a process for everything. We have the initial discovery call, which is about a 20-minute call, and we just get to know you, understand, get your general information, understand what you've been doing in the past on health insurance, and kind of maybe what you might be looking at in the future, along with your doctors and medications and that sort of thing. And then we put together a personalized presentation for you, which is much like today. We go through the basics of Medicare again, and so you understand all that. You can ask questions. Then we take you through kind of what your options are, which are specific to your needs based on our discovery call, right? So we're not wasting time, and we get you enrolled there. And then about 3 weeks later, usually, after you've received your welcome kit, after you've been enrolled and get your welcome kit, we have a second presentation, which we call the orientation meeting. And we just take you through your plan, make sure you know how to access all your benefits. We answer all your questions. We get you additional resources that you might need. And then we also we create a personalized PDF for you, which contains all your links and information all on one page. We just try and make it as simple as possible. And so that's something we provide as well. And then on the orientation meeting, let's see, what else was there that I wanted to cover? Details, I think that's about it. Okay. All right, moving along. There's one thing I forgot, but sorry, you can call me and I'll remember then. Okay, but as I had mentioned here at the beginning, you've got two options, right? So let's take a look at those. You have two options. One is you stay with original Medicare Part A and Part B. You're going to still pay your Part B premium. You're going to add a supplemental plan that's going to pay for your out-of-pocket costs and your gaps and that sort of thing. And that'll be $150 to $250 a month, depending on what age you are when you come in. And then a drug plan can run you anywhere from 0 premium to 200, depending on what medications you might be taking. So your total cost, if you go with option 1, which is a supplemental, which gives you total freedom to go to any doctor, any hospital in the nation that takes Medicare, is going to cost you anywhere from $350 to $450 all in. So that would include your Part B plus your supplemental plus your Part D. The other option is your Advantage HMO called Part C, and that you're still going to pay your Part B premium of $200 and $290. Everyone pays that. You pay that for life, but you're not going to have, at least here in California, generally you don't have a premium that you pay for the plan. It's going to cover all your out-of-pocket costs, just like your supplemental, and your Part D drug plans included. So your only cost here is $200 and $290, and it's going to cover extra benefits that you don't have to purchase additionally, like dental and vision. And usually both plans come with gym membership, which is kind of sweet. Okay. All right, but that's it. Thank you so much for joining me today. If you want to schedule a call, you can call me directly here at this number, or you can email me. You can also visit our website, John Riley and Associates. We have a landing page for individuals. So if you're looking to get help with Medicare, you want to go to MedicareSouthBay.com for John Riley and Associates. It's called MedicareSouthBay.com. If you're a partner joining us today, an employer, CPA, advisor, you can go to RileyEBI.com. That's RileyEBI.com, and we've got helpful videos and all your information there as well. So either place, you can schedule a call with us. for a partner or an individual, and we would love to work with you. And there's no cost for our services. We're a broker, and so we handle most of your plans and carriers. And so if you have any questions, just give us a call. Okay. All right. Thanks so much.